Gomez, your student nurse for today. So I'm here to reposition you to move up in bed, to avoid bed sores, and to promote body circulation. So may I know your name, ma'am?
My name is Vanessa Narco.
Your birthday?
September 20, 2022.
Okay. Can you assist me in helping you reposition, ma'am?
Yes.
Okay, so let me have my hand hygiene first. I will do that in a while. Moving a client up in bed. Moving a client up in bed is to assist a client who have slid down in bed from the fowler's position to move up. I'm Bea Grace Gomez, your student nurse for today. So I am here to reposition you into turning your body into lateral position or prone position. So may I know your name, ma'am?
My name is Vanessa Narco.
Your birthday?
September 2022.
So can you assist me for today?
Yes.
So I will wash my hands first to promote proper hygiene. So let's start the position now. Turning a client to the lateral or prone position in bed. Movement to the lateral or side lying position may be necessary when placing a bedpan beneath the client, when changing the client's bed linen, or when repositioning the client. position you by log rolling you to avoid bed sores and to promote body circulation. So, may I know your name, ma'am?
My name is Maricina Martin.
Your birthday?
September 23, 2008.
So, let me have my hand hygiene first to avoid any bacteria that pass on you. Okay, ma'am? I'll be back for a while. So, I'll do the positioning. So, you can help me in assisting you, ma'am.
Yes.
So, brace yourself. Then, raise your... And I'm having an assistant because I cannot do it alone. Sige, go. Log rolling a client. Log rolling is a technique used to turn a client whose body must at all times be kept in straight alignment like a log. An example is the client with back surgery or a spinal injury. Considerable care must be taken to prevent additional injury. This technique requires 2 nurses or, if the client is large, 3 nurses. For the client who has a cervical injury, 1 nurse must maintain the client's head and neck alignment. Hi, ma'am. Good morning, ma'am.
Good morning.
I'm Bea Grace Gomez, your student nurse for this morning. So I'm here to reposition you and assist you in getting up in bed. So may I know your name, ma'am?
My name is Ernest Martella.
Your birthday,
September 23, 2008.
your age.
17.
Okay. So can you assist me in getting you up, ma'am?
Yes.
So okay, let me have my hand hygiene first, and I'll be back in a while. Ready na ka, ma'am?
Yes.
Sige. Pagdala natin ang mga... Assisting a client to sit on the side of the bed or dangling. The client assumes a sitting position on the edge of the bed before walking, moving to a wheelchair or chair, eating, or performing other activities. Hi, ma'am. Okay na, ma'am? Makaita na to. Mukha, ma'am. Kasi sa kasi ang sal. Sige, makunin mo, ma'am. to, ma'am. So, I'm your student nurse for today. I'm Beatrice Gomez. So, nako dere para ipa-transfer ka sa chair kay para maka-sorry ka sa wheelchair around to see the beauty of nature. So, may I know your name?
My name is Lisa.
Your birthday?
September 23, 2002.
Your age?
17.
So, makasis lang ka na ako today, ma'am. Okay, so I will, mabugas ako sa akong kamot, then mabalik ko dere yung kamot. Hi, ma'am. Yan ako, ma'am. So, ready na ka, ma'am? Saan na ba? Transferring between bed and chair. The purpose of transferring between bed and chair is a client may need to be transferred between the bed and a wheelchair or chair, the bed and the commode or a wheelchair and the toilet. There are numerous variations in the technique. Which variation the nurse selects depends on factors related to the client and the environment that are assessed prior to beginning the transfer. Transferring between bed and stretcher. The stretcher or gurney is used to transfer supine clients from one location to another. Whenever the client is capable of accomplishing the transfer from bed to stretcher independently, either by lifting onto it or by rolling onto it, the client should be encouraged to do so. If the client cannot move onto stretcher independently and weighs less than 200 pounds, a friction-reducing device, example is slide sheet and or a lateral transfer board or an air transfer system should be used, and at least 2 caregivers are needed to assist with the transfer. Assisting a client to ambulate. The purpose of assisting a client to ambulate is to provide a safe condition for the client to walk with whatever support is needed. So, in assisting a client to ambulate, you need assistive devices for safe ambulation, examples, gait or transfer belt, walker, cane, sit-to-stand assist device, and lift with ambulation sling. Wheelchair for following client or chairs along the route if the client needs to rest. Portable oxygen tank if the client needs it. Lifting patients. Lifting patient to a chair or wheelchair using 2-man carry. 2-man lift is for some reason if a patient is unable to bear weight on his legs, it will be necessary for 2 people to transfer him in and out of bed. It is not necessary that 2 lifters be big and strong in order to lift a heavy patient. The lifting is done through proper mechanical use of the body. If you feel a strain on your back, you are doing something incorrectly.